This video covers the national guidelines for pregnant and lactating mothers, focusing on community health nursing for exam preparation. Remember Marie Forleo's words, "Success doesn't come from what you do occasionally, it comes from what you do consistently." India's maternal health goals aim to reduce the maternal mortality ratio, or MMR, and the infant mortality rate, or IMR. The current MMR is around 97 per 1 lakh live births. Antenatal care registration is ideally done within the first trimester. This is carried out at centers like the sub-center or Anganwadi center, and the Mother and Child Protection Card is the key document. The Government of India recommends a minimum of 4 antenatal care visits, while the World Health Organization currently suggests 8 contacts. According to ICMR 2020 guidelines, energy requirements for a reference woman of 55 kilograms performing moderate work are specified. Protein is crucial for fetal growth and maternal tissue expansion, and specific requirements are detailed in the ICMR 2020 guidelines. Quickly reviewing key points. The minimum ANC visits in India is 4. The added calories in the 3rd trimester are 475 kilocalories. Folic acid prevents neural tube defects and should ideally start preconceptionally. IFA supplementation, or prophylactic dosage for non-anemic women, should start from the 4th month and continue for 180 days during pregnancy and 180 days postpartum. The red tablet contains 60 milligrams of elemental iron and 500 mcg of folic acid. For anemic women with hemoglobin between 7 and 11 grams per deciliter, the therapeutic dose is 2 IFA tablets daily, providing 120 milligrams of elemental iron and 1 milligram of folic acid per day. Calcium supplementation should start from 14 weeks of pregnancy, with a daily dose of 1,000 milligrams. It must be taken throughout pregnancy and for 6 months of lactation, keeping a 2-hour gap from iron supplements. Deworming uses a single 400 milligrams dose of albendazole, given after the 1st trimester, typically at 14 to 16 weeks, to treat helminthic infestation. It is contraindicated in the 1st trimester due to teratogenic risk. New guidelines have replaced the tetanus toxoid vaccine with TD, which covers tetanus and adult diphtheria. The correct answer to the question is B, 60 milligrams iron plus 500 mcg folic acid. The Pradhan Mantri Surakshat Matritva Abhiyan, or PMSMA scheme, was launched in 2016. It occurs on the 9th of every month to provide free, comprehensive and quality antenatal care to pregnant women in their 2nd and 3rd trimester. The PMSMA uses color coding on the Mother and Child Protection Card. Green indicates no risk, red indicates high-risk pregnancy, blue indicates pregnancy-induced hypertension, and yellow indicates comorbid conditions. The Janani Suraksha Yojana, or JSY, aims to promote institutional delivery by providing financial incentives, especially in low-performing states. The Janani Shishu Suraksha Karyakram, or JSSK, launched in 2011, ensures zero expense for delivery and includes entitlements such as free drugs, diagnostics, diet, blood, and transport for pregnant women and sick infants up to 1 year. The Pradhan Mantri Matru Vandana Yojana, or PMMVY, is a conditional cash transfer scheme for the 1st live birth. It provides 5,000 rupees in 3 installments. Let's review the rapid-fire answers. PMSMA is held on the 9th of every month. The JSY rural incentive in LPS is 1,400 rupees. JSSK guarantees free delivery and transport. A red sticker in PMSMA means a high-risk pregnancy. The Lakshya guidelines aim to improve the quality of care in labor rooms and maternity operation theaters by reducing maternal and newborn morbidity and mortality through strategies like respectful maternity care. Postnatal care covers the mother and baby for 42 days after delivery. For home deliveries, a minimum of 4 visits are scheduled, within 24 hours, on the 3rd day, on the 7th day, and at 6 weeks. Lactation requires more energy than pregnancy, and the ICMR 2020 guidelines specify nutritional needs during this period. Breastfeeding guidelines emphasize demand feeding. Colostrum must be given, and exclusive breastfeeding is recommended for 6 months. Initiation should occur within 1 hour of a normal delivery or within 4 hours of a C-section. Pregnant women are at high risk for severe malaria. Long-lasting insecticidal nets are promoted. Treatment involves quinine in the 1st trimester and artemisinin combination therapy in the 2nd and 3rd trimesters. The Prevention of Parent-to-Child Transmission program involves mandatory opt-out screening for HIV. Lifelong ART, the TLD regimen, is started immediately. Breastfeeding is recommended for 6 months with the mother on ART. Gestational diabetes mellitus screening using the DIPSI method involves an oral glucose tolerance test with 75 grams of glucose. If the plasma glucose is 140 milligrams per deciliter or more after 2 hours, it indicates GDM. The correct answer regarding additional energy requirements is C, plus 600 kilocalories. The correct answer is C, 300 mcg. Danger signs requiring immediate referral include vaginal bleeding, severe headache, blurring of vision, convulsions, severe abdominal pain, reduced fetal movements, and swelling all over the body. The Surakshit Matritva Ashwasan, or Suman initiative, launched in 2019, aims for zero preventable maternal and newborn deaths by guaranteeing assured, dignified, and quality healthcare at no cost. Fundal height rules are used to estimate gestational age. At 12 weeks, it is at the symphysis pubis, at 20 to 22 weeks, it is at the umbilicus, and at 36 weeks, it is at the xiphisternum. The Pritchard regimen for eclampsia uses magnesium sulfate as the drug of choice. Loading and maintenance doses are specified, and safety checks include the knee-jerk reflex, respiratory rate, and urine output. The correct answer is B, after 12 weeks. The Medical Termination of Pregnancy, or MTP Amendment Act of 2021, allows termination up to 24 weeks for specific cases. Shoulder dystocia, indicated by the turtle sign, is managed using the McRoberts maneuver, which involves hyperflexion of the mother's legs and suprapubic pressure. Fundal pressure should never be applied. Quickly review key dosages: IFA prophylaxis, IFA for anemia, calcium, albendazole, misoprostol for PPH prophylaxis, and the antidote for magnesium sulfate. To summarize the schemes, JSY offers cash for institutional delivery. JSSK provides free cashless services. PMSMA offers free ANC by specialists. PMMVY provides 5,000 rupees for the first child. Lakshya improves labor room quality, and Suman guarantees zero tolerance for maternal death. Remember that the best preparation for tomorrow is doing your best today. Keep pushing in your training to save lives. Thank you for watching this video. All the best for your exams.